So hormone pellets are a great therapy. Basically, you've got a slow, steady release of hormones, which probably is the best way to deliver hormones outside of maybe a cream or a vaginal application. Certainly, probably a little better than a troche or a patch, which for some women only deliver estrogen and can have side effects like rashes and that type of thing. Pellets have been around since the 40s, and they're kind of gaining popularity again, especially in the context of bioidentical hormone replacement therapy. Do you feel that at all? Okay, pinch here. Very good. The only thing in these pellets are hormones, so they're basically designed to slowly deliver over this period of time. Typically these hormones kick in within just a few days, so you shouldn't really have any lapse in what you're doing and the time that this starts to work for you. Yeah, and she was just filing that compliance with the oral troche of bioidentical hormones was a little bit of a challenge, and we do hear that from a lot of female patients, whether they're using a topical cream or 2 or 3 different creams and maybe a sublingual lozenge. Those protocols are great, but they can get a little cumbersome, and the delivery is often not optimal. Sometimes there's variable rates of absorption. The half-life of the hormones doesn't always quite get a woman, 1 or 2 day coverage in terms of half-life. And a slow, steady release of hormones probably best mimics nature. It's almost like putting a tiny mini ovary in the site of the subcutaneous fat tissue of the buttock here. So I also have the patient on thyroid hormones, so we're going to follow up with her in approximately 3 months. I'm going to check her hormone levels and thyroid levels. At about the 3-month mark, it won't quite be the peak levels in her blood, but we'll start to see what is still floating around her bloodstream about 3/4 of the way into the pellet cycle, which, like I said, is about 4 to 6 months.